Good evening, everyone. Now at 6 o'clock, doctors and hospitals overwhelmed as we head into the new year. And now they say they're concerned about another potential surge as a result from New Year's gatherings.
Yeah, in fact, today I spoke with a doctor who didn't mince words. He says healthcare workers are struggling right now to stay afloat, and they hope Hoosiers play it safe tonight. Doctors fear the New Year's Eve countdown amid another COVID surge will have a sharp contrast this year between what's happening outside and inside our hospitals.
There could be somebody in the hospital in Indianapolis that's doing CPR on an ICU COVID patient as the ball drops tonight. And you can imagine the toll that that would have on the healthcare worker seeing all this play out, just wondering, does anybody care anymore?
Dr. Carlos just put 2 more COVID-positive patients on ventilators at Eskenazi. His harsh reality doesn't stop for a holiday.
13 of the 20 patients I just saw had respiratory failure from COVID-19.
Beds are full in the ICU at virtually every hospital right now, even neighboring states requesting transfers because they're maxed out in critical care.
I've gotten in the habit of asking the caller, what call number was I for you? And I've heard anywhere from 10 up to 45 from a caller from Kentucky yesterday.
He says with Omicron, there are a few more breakthrough cases happening. Most of those have underlying lung conditions.
We are seeing some breakthrough infections in vaccinated patients. I have yet to see a breakthrough infection in a vaccinated plus boosted patient.
That booster, key in protecting you from getting seriously sick. And headed into a crowd-centric weekend between the Colts game and New Year's celebrations, Dr. Carlos says wear a mask, try to social distance, and for some, skip the parties altogether.
If you live with somebody who's immunosuppressed or older and at risk for severe disease, this new strain, Omicron, is so incredibly contagious that your risk of getting it and giving it to someone you love and care about is high. So you want to avoid those situations.
We also want to let you know tonight that right now there is a huge demand for COVID tests, and overwhelmed hospitals are putting out an urgent request asking people to avoid trying to get a COVID test from the ER. Instead, if you have mild symptoms, you can go to their virtual visits app or call an urgent care clinic or community site to get tested. We have all those details posted for you tonight on WTHR.com.